Hello, it's Dr. Tugbiyele here, urogynecologist, and in this video we're going to talk about what are complications of gynecologic surgery. You know, many hundreds of thousands of gynecologic procedures are performed in this country, in the United States, every year, and most times things do work well as planned. However, as surgeons, we tell patients that, granted, most times things work well. No one's perfect, and there might be some situations where there might be an unplanned or inadvertent injury that occurs as a result of surgery. Some of the organs that exist in the pelvis with surgery are the blood vessels, bowel, nerves, ureters. The ureters are actually the drainage tubes of urine from the kidney to the bladder. And so any one of these organs can sometimes be injured inadvertently, accidentally during surgery. The one or the two conditions that I want to actually focus on are fistulas. So what are fistulas? Fistulas are connections, abnormal connections that can occur as a result of injury. And so there are two types of fistulas that I want to talk about in this video. A vesico-vaginal fistula is a fistula or abnormal connection of the bladder to the vagina, and a recto-vaginal fistula is a potential connection of the rectum to the vagina. And so if there's an injury of the bladder in the same area or in proximity to the bladder, there could be a connection that occurs between the bladder and the vagina. That injury can be thermal, we say, meaning there was a burn or an inadvertent cut of the bladder that then heals to the vagina, and then that causes a connection. Or some of the blood supply is cut off, and because that area no longer receives normal blood supply, there could be the tissue quality it reduces, and that can sometimes lead to an abnormal connection to the bladder, from the vagina to the bladder or the rectum to the vagina. If that occurs, for example, in a vesico-vaginal fistula, meaning a connection of the bladder to the vagina, that can lead to women noticing leakage of urine from the bladder to the vagina. So oftentimes women may present with abnormal vaginal leakage of urine. In a rectovaginal fistula, because it's an abnormal connection of the rectum to the vagina, unfortunately, women may experience stool coming out of the vagina that was from the rectum. And so these are conditions that are quite bothersome. Thankfully, they are not as common as other conditions that occur in the pelvis that we as urogynecologists take care of. But when it does occur, it is very life-altering. It does impact a woman's quality of life. As you can imagine, if there's urine coming through the vagina, women can smell like urine. Oftentimes, patients will have a continuous flow of urine through the vagina that it cannot be contained, and she's wearing pads, and it's just a continuous flow. And that can cause irritation, vaginal vaginitis or vaginal irritation, inflammation, changes in the skin and the smell, and pad usage, the cost. I mean, it really goes on and on. And with a rectovaginal fistula, if there's stool coming to the vagina that shouldn't be, obviously, then there's the odor, there's the irritation, infections, inflammation in the vagina, and it affects quality of life. It can affect a woman's mood, how she feels. It's just not good all around. And so thankfully these are not common, but when that does occur, it's very important to have it addressed sooner rather than later, by the right person, the right specialist. And that's what we're going to focus on in this video. So what would a patient have in terms of symptoms, or actually in terms of her history? Typically a history of previous surgery, or it may be a vaginal childbirth, where if the labor process was too long, maybe pushing for too long, or the baby was too big, or whatever. There could have been an abnormality of the laboring process or vaginal birth process typically, or it could be even during a C-section. These things can also occur during pelvic surgery. It can occur during hysterectomy. It can occur with endometriosis surgery. These are oftentimes very complex surgeries that involve a lot of suturing and or burning of tissue, and complex procedures that can lead to either injury to the organs that then leads to abnormal connections. So with a woman who has a a vesicovaginal fistula, she will again have urine coming through the vagina, irritation, and a rectovaginal fistula, it could be stool coming through the vagina. And during a physical exam with a speculum, we can either see urine in the vagina or stool in the vagina. That we at times may have to put a liquid dye to find the fistula, find the number of fistulas, where they are, where they're located, how many they are, and or if it's sometimes even dye in the rectum to determine where and how many and the fistulas are, if they are rectovaginal fistulas. In terms of imaging studies or diagnostic tests, a cystoscopy is a procedure that is done in the office to look in the bladder, and that can help to determine where, how big the fistula is. If it's a vesicovaginal fistula, sometimes the fistula can be not just the bladder but the urethra, and so the leakage that occurs from the urethra into the vagina, not only perhaps from the bladder. With rectovaginal fistula, sometimes a colonoscopy or anoscopy looking into the rectum can be helpful. Putting dye through the rectum can be helpful because that dye will then stream up into the vagina to help to determine how big the fistula is, the number, location. Sometimes a CAT scan is required to determine where the leakage is and how much and how many fistulas perhaps. And so those are just some of the things that are done in terms of the workup. In terms of solutions, again, a lot of women would require surgery. Are there times when a woman has a small fistula that can heal on its own? Yes, that certainly can happen. Especially if it's a vesicovaginal fistula, sometimes we may be able to place a Foley catheter. This is a catheter that drains urine away from the bladder. And so then that area in the bladder has a chance to heal away from the vagina. That is sometimes helpful. However, if the fistula is too big, if there are a number of them, if it's a rectovaginal fistula, there's no catheter that we have for the rectum per se, then a lot of times these conditions require surgery. And it's important to have a skilled surgeon who's experienced in treating fistulas take care of this condition, because the first time at it is the best, has the highest success rates, oftentimes in the high 80 to 90% success rate. So taking care of it the first time, the best way is oftentimes the most effective way to treat this. And so I know I spoke a lot about fistulas and general complications of GYN surgery. Thankfully, they do not occur commonly. However, when they do occur, it's important that they be recognized early and treated well. And so I tell my patients that they don't have to live with any of conditions. And I do see a lot of patients who are referred to me to address these conditions that occurred from the surgeries that occurred with their primary surgeons, gynecologists, per se, or obstetrician during the time of childbirth. And so we're able, thankfully, to take care of these women successfully and improve a woman's quality of life. So we never want a woman to feel like she has to live with it. Oftentimes, having it checked out, evaluated early is essential. And so if you're interested in more information about fistulas or about gynecologic surgery, please do visit my website, Dr. Stephen Tugbiyele, that's Dr. Stephen with a PH, Tugbiyele, Tugbiyele.com. You can also visit my YouTube channel here, where I have other videos that I talk about pelvic floor problems and solutions to those problems. And it's important that you see a fellowship-trained urogynecologist. We have the expertise, the training to take care of these conditions as specialists. Thank you so much for watching, and subscribe to the channel, and please do share it with someone else that you know we can help, because I'm very passionate about education, so please do share this. And my practice website is Northside Center for Urogyn.com. My office number is 470-325-1280. I'd love to, if you have any of these conditions, I'd love to be able to help you and improve your quality of life. Till the next time, take care. Bye-bye.